Good day, ma'am, and assalamualaikum. Today, I'm going to perform the assessing of the integument. Assessment of the integument refers to the examination of the skin, hair, and nails to evaluate overall health, detect abnormalities, and identify signs of systemic or dermatologic conditions. The skin, being the largest organ of the body, can reveal important information about the patient's overall health. The purpose of this is to assess the health and integrity of the skin, hair, and nails, to detect any signs of dermatological conditions, schema, psoriasis, acne, rashes, or skin infections, to identify systemic conditions that may manifest through the skin, to monitor for signs of skin cancer or other abnormal growths. The equipment here is gloves to prevent contact with bodily fluids or potential contaminants when touching the skin, pen light or flashlight to better inspection of skin lesions or abnormalities, particularly in areas that are less exposed to light, measuring tape or ruler for measuring the size of any skin lesion or wounds, magnifying glass optional for detailed examination of small lesions or rashes. Consideration: patient comfort. Skin assessment involves touching sensitive areas, so it's important to be gentle and ensure the patient feels uncomfortable during the examination. History: ask the patient about any skin problems they've noticed, such as rashes, aching, changes, and moles or walls that do not help. Inquire about personal habits, environmental exposure, and any family history of skin condition. Cultural sensitivity: be aware of cultural differences in skincare practices and attitudes towards skin condition. Environment: ensure the room is well lit and the patient is comfortably positioned to allow for an optimal examination of all body areas. Systemic consideration: remember that skin changes can reflect underlying systemic issues. Things to document after the procedure: skin color, pallor, light or pale skin may indicate anemia or poor circulation. Cyanosis: bluish discoloration often seen around lips or fingertips may suggest inadequate oxygenation. Jaundice: yellowish tint to the skin in sclera can indicate liver dysfunction or bile duct obstruction. Erythema: redness of the skin possibly indicating inflammation, infection, or sunburn. Skin integrity lesions: document the shape, color, and distribution of any skin lesions. Wounds or ulcers: record the size, location, depth, and any signs of infection. Texture and turgor: skin texture, hair color, and texture. Document the color, texture, and thickness of the hair. Changes may indicate nutritional deficiencies, thyroid problems, or other health condition. Hair loss: not any thinning or bad patches which could suggest alopecia areata, hormonal imbalance, or systemic diseases. Scalp condition: inspect the scalp for dandruff, lesions, redness, or tenderness. Fungal infections like ringworm or dermatitis may present with scaling. Nails color: nail color can indicate circulatory or respiratory condition. For example, cyanosis can be seen as bluish tint to the nails, while yellow nails might suggest fungal infection. Shape and texture: examine the shape or signs of deformities like clubbing, lung disease, or cardiovascular or pitting, which can be associated with psoriasis. Capillary refill: press on the nail bed to assess the return of color, which should happen within 2 seconds. Delayed of a capillary refill can indicate circulatory issues. Edema: check for any swelling or pulpiness, particularly in the lower extremities or should the eyes. Document the extent. Rashes or skin changes: note the appearance of any rashes. Document any patterns that may suggest specific conditions. And signs of infection: observe any areas of skin for signs of infection such as warm, redness, swelling, or discharge from wounds or the abscesses. Skin elasticity: perform a skin sugar test by gently pinching the skin of the hand or forearm. A slowly turn of the Skin to age normal position may indicate dehydration, moles or lesions. Inspect any moles or pigmented lesion for symmetry, border irregularity for irregularity, color variation, diameter 6 millimeter in evolution. Good morning, sir. I am Johanna, your student nurse. Today, I will be assessing your integument. First is fully exposed to be examined. Adequate exposure is necessary for true examination. Number 2 is assessed under strong direct light. And weak and direct lighting can distort colors and mask jaundice. And to note the general color as well as local variation. Inspect uniformity of skin. Color should be consistent with genetic background. And inspect and palpate and describe skin lesions. Describe the skin lesion size, shape, color, distribution, configuration, and if there's any dryness, tenderness, or pain, may be indicative or traumatic or pathologic changes. And palpate. Next is palpate skin temperature with the dorsal aspect of your hand. And next is palpate skin texture, moisture, and hydration. Provides information regarding metabolic activity and fever. So, next is palpate skin turgor by pulling the skin and noting its return. Provides data on fluid status with gain loss. So, next is assess for presence of edema by firmly pressing over bony of tibia or ankle.
Note location, color, temperature, shape, type, and degree to which the skin remains intended or pitted when pressed by finger.
Next is measuring circumference of extremity with a millimeter tape of may be useful. Next, inspect the nail plate, shape, texture, nail bed color, and the tissue surrounding the nails. Provides information on perfusion and oxygenation status. Next is assess capillary, revealed by pressing on the nail and releasing.
Take note how many seconds did the color return to its usual color. Cyanotic or sluggish color return may suggest cardiovascular or respiratory dysfunction. Examine all the nails on both hands and feet. Note consistency, smoothness, thickness, adherence to nail bed. Note shape and contour.